scanning the room.
Hello, my name is Sarah New, and today I'm going to be demonstrating how to do an IV bolus of medication, as well as how to hang a secondary small bag of medicine. Just showing the camera that there's nothing on my paperwork. Okay, so I've entered the med room. I have washed my hands. I've got my doctor's orders, and I would pull up my patient's MAR. I've already assessed my patient, so I know the need for this treatment. So I'm going to do, first I need to compare the orders to the MAR. So doctor has ordered patient to receive 20 milliequivalents of potassium chloride, diluted in a bag of 0.9% normal saline, 250 mils of that, and to be infused at 125 mils per hour, as well as morphine sulfate 4 milligrams IV push every 2 hours as needed for pain. So I need to compare that to the MAR and just make sure everything matches, and it looks good. So I can go ahead and get the medication. I'm gonna pull it out of the Pyxis and do my first med check. So first I'm gonna get my potassium chloride. I can see that as the correct med, and available is 40 milliequivalents per 20 mils. So the doctor's ordered 20 milliequivalents. I know with my dimensional analysis that I need to withdraw 10 mils of this medication. I'm just gonna write that down. Okay, so there would be 20 milliequivalents per 10 mils. All right, so that matches. It's not expired. Color looks good. It has not been opened. So that's good. And also just making sure I have the right saline to diffuse that with, and it's good. It's not opened. It's not expired. It hasn't been tampered with, and it is the correct amount. All right. So next is the morphine. I got my morphine. It matches, and available is 10 milligrams per mil. So I know that I need to withdraw 0.4 milliliters, and I'm gonna dilute that in 1 milliliter. I'm sorry. 1 milliliter of normal saline. So that's good to go. I can now prepare my medication. So I need to put on gloves. Okay, so I'm gonna get my morphine ready first. I'm gonna go ahead and grab that and do my second med check. Everything matches. I will get my syringe, my drawing needle, and I'm going to pop the cap. You're going to clean this hub for 15 seconds. Video purposes, that was 15 seconds. While that's drying, prepare my syringe. Okay. And withdraw 0.4 of air. Check that. Before I inject it, I would clean it again, but video purposes, it's clean, it's dry. Inject that into the airspace. Invert. Big old air bubble on that one. Hold on. All right, so just make sure your bubble is not in the air when you're pulling your meds out. You're going to go past your amount needed. And push up. I'm going to get a little bit more so that I can make sure there's no air bubbles. Okay, so that's good. I'm going to confirm with my second nurse.
Looks good.
Okay. And now I will get my 3 mils of normal saline. And we're going to withdraw 1 mil, so make it 1.4. Okay. That's good. Needle and sharps. Maintaining aseptic technique. That little guy wants to fall. Okay. All right, so my morphine is prepared. I would go ahead and put on the medication label stating the dose and the person who prepared it. Okay, so now I'm going to go ahead and get my potassium ready, do my second med check. Everything matches. My normal saline matches. Pop the top. I would clean, 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 clean for 15 seconds. And get my 10 ml syringe. While that's drying, withdraw 10. All right, so the alcohol just dried, so it's safe for me to inject. All right. Really hard to get out, so you just want to pull out all that air too. Okay, so I'm past my 10 mils. Make sure there's no air bubbles. And get up to the dose of 10. I would be over a sink. I'm so sorry, Gail. Let's go over the trash can. Okay. Verifying that that is correct.
Looks good.
Okay. And just to keep that sterile, I'm gonna recap. And open it. So second med check with the saline as well. I'm just making sure that it's the right amount, that it's not leaking. Color is good, and it does match my MAR. So I need to clean the port site. Again, 15 seconds, allow that to dry. And the sharps, gently mix, and you would clean that port site again, just to keep it nice and clean. All right, so everything's good. You don't want to mix that too hard. Get the, keep it from forming air bubbles. All right, so everything has been prepared. I'm going to go ahead and go to the patient's room. I would bring my morphine with me, change my gloves, wash my hands. All right, so I've entered the patient's room. I'm going to verify the patient with 2 patient identifiers. She tells me that her name is Shirley Coast, and her birthday is 4/3 of 1987. That is what my MAR says, so I know I have the right patient. She tells me that she has an allergy to codeine, and none of this is codeine, so I know that that's okay. And then I also, since we are doing IV medication, IV insertion at the same site with these meds, I need to make sure that they are compatible, and they are. So we are going to go ahead and give this patient her morphine. So I'm going to do my third med check. I have applied gloves, I've washed my hands, I've done all that good stuff. So, okay, got my meds. I'm going to go ahead and flush. so I would want to clean this port site again. Just scrub really hard, nice 15 seconds there. Attach. I have assessed the site. There's no signs of phlebitis. I'm going to pull back just a little bit and get a blood return to confirm patency right after I open that. And just gently flush. Okay, so that's good. All right, so now we can go ahead and push our morphine. This is a slow push med, so you want to do about 1/4 ml per 15 seconds. So, but for video purposes, I am just going to push it in. But while I'm infusing, I want to make sure that I'm assessing the patient, I'm assessing the site, I'm looking for any adverse reactions to this medication. So you would never push that fast, but we're saving time. Okay, you're going to get your second flush. And I dropped that, so I'm going to clean it again, make sure it's dry. Attach. Now there's still medication in this tube, in the lumen, so you want to just push slow for the first like 1/2 ml and then just get it in there. And for that, I'm going to lock and then release. Okay, so patient's got her morphine. She's kind of settling down now, so I can go ahead and get my bag ready. I'm going to do my second med check for my potassium. I had applied a label in the med room to this. I forgot to mention that. So here's my medication label on that bag. And that's how you do your third med check. So I would compare that to my MAR. Everything is good, is the right amount. I know it needs to infuse at 125 mils per hour. So that's going to be an infusion time of 2 hours. So go ahead and get your tubing. This. Make sure your cassette is closed. This normally has a lid on it. I don't know where that went, so that would have a sterile lid on it. All right, so we would get our bag, pop, insert. Way better than that, without touching anything. Hang the bag. Fill your drip chamber halfway. On your tubing. Okay, so my tubing is primed. I'm gonna go ahead and set this in here while I prime the rest. Okay. It's coming, it's just slow. This tubing's been used a bit. All right, so we would maintain aseptic technique. And watch the line. Looking for bubbles. There's a few in there, so I'm getting them out. Kind of checking the whole length of the line, and I think it's good. So I would put this back on, making sure it stays sterile. And I'm gonna go ahead and put this in. So again, clean the port since it's been exposed to air for a minute. A lot. Okay, so our meds are attached. I'm going to clean these up. And then I would set my flow rate of 125 mils per hour. I already did my math on that, so I know that it's going to be 2 hours, so I would also program that. Now I need to just go ahead and document everything that I've started and how the patient tolerated it, site assessment. I'm going to be back in about 15 minutes to reassess her pain. Okay, I would exit the room, do all the hand hygiene stuff, and it's 2 hours later, so I need to come back in because the meds are done. So I would again identify my patient, name, date of birth, all that good stuff. Don gloves after washing my hands, confirming allergies. So now I need to go ahead and turn off my pump, and I'm going to just, I would have opened that lock before I started my infusion, so that was open. And okay, I'm just going to go ahead and open. Hang that for a minute, clean the port, 15 seconds, allow it to dry. Cool. You already know it's patent, so we're just going to go and push gently. Okay. All right, so I also would have put my IV label on my IV tubing so that we know when it was started and by whom for the next nurse on shift. So shaky. All right, so I just want to go ahead and I would clean this port since it's been sitting in air for a minute. And just attach this so that it stays sterile in case we need to use this tubing again. Okay, so doff my gloves, clean my station. I need to document everything that I've infused, the type of fluid that I infused. I need to include all of the saline flushes, amount of fluid that I infused, how the patient tolerated it, do a quick mini assessment to see how she has reacted to the treatment. Document that as well. And I think that's everything. Oh, and of course I would throw this in the sharps if it was empty. If not, I need to go back to the med room and waste it with a second nurse to confirm. And I think that's everything.